So it's my privilege to speak today about prevention of Alzheimer's disease. And this is a huge topic. My goal here is to provide an overview of how lifestyle factors influence the risk for sporadic dementia. And certainly future treatments are very likely to be preventative in the sense that they will probably be started prior to symptoms or very early on in the disease process. So I'm not going to be focusing on that angle of things. I'm going to be focusing on lifestyle factors. And this is a huge topic. So what I want to highlight during the talk is just a few pieces of new research over the past couple of years. And one question that I saw, I think in the question Q&A already, was sort of the influence of genetics versus lifestyle risk, and in those with a high genetic risk, sort of what is the influence of lifestyle. So I'm going to try to address that, and some more recent data about the Mediterranean diet, about multimodal interventions, and a little bit of new information about hearing loss and the association with dementia. And lastly, sort of as introduction, I've starred Alzheimer's disease here because much of the data that we have about dementia prevention and sort of the risk factors for dementia is based on population studies really from prior to the era of having biomarkers. And so we know Alzheimer's is the most common cause of neurodegenerative dementia, but probably most of this information does refer to or does apply to sporadic dementias in general, particularly given what we learned from Dr. Hirsch-Reinshagen earlier, is that it's very, very common for individuals to actually have multiple different types of pathology. So I'm just going to talk for a moment about sort of what would be the ideal way to be able to identify what things somebody can do to prevent dementia from developing. So I've sort of outlined here what you would, in an ideal world, if this was possible, you'd identify and recruit a representative population, ideally of quite young adults. You'd randomize these people into different types of interventions, different diets, different exercise routines, different levels of education, and then you'd follow these individuals for many years and try to identify who does and does not go on to develop dementia. Now, certainly, this type of paradigm really is just not possible, for a few reasons. One being just the ethics of being able to randomize people into something like education is just, not possible. The length of time that you would need to follow people would be in the decades, and the cost of organizing something like this would be extraordinary. So in general, what we do have to inform, what we do know is large observational studies, which usually have been retrospective, so looking back over thousands of people over years and looking at their sort of lifestyle risk factors, and then seeing a correlation between those factors and development of dementia. Increasingly, what's quite exciting is that biomarker-based studies are going to be able to, and have been able to, show impacts of lifestyle interventions over a much shorter period of time. And in many cases, we can infer what may happen over a much longer period of time by relying on a biomarker. And there are increasingly some prospective studies following people, not looking backwards, but actually looking forward over time. People have normal cognition at baseline and seeing what different lifestyle factors influence changes in cognition over time. So basically, the scientific community has, with these types of tools, established in general that there is a significant proportion of dementia risk for sporadic dementias that at this point does seem to be sort of set in stone. I wouldn't say that with certainty. There probably are some things in this bubble, this circle, that are not observed to be modifiable that may well be. But what has been identified so far, I would say in aggregate, is that about 35% of the risk of sporadic dementia is potentially modifiable. And I think Emily used a really excellent analogy about the jar and pebbles, which I've just sort of pasted here. And that potential modifiable sort of risk category is what's going to potentially increase the height of that jar and reduce the risk of developing a dementia. So I'm just going to list here the factors that have been identified. So lower education, hypertension, obesity, hearing loss, which I've started because I'm going to speak a little bit more about that later, smoking, depression, physical inactivity, social isolation, diabetes, and diet. And I'm just going to speak for a moment, just stepping back, in that there is a lot of press, and there certainly is a huge number of people with dementia globally, and that is increasing. And that, of course, is a huge burden for families, for societies, for caregivers. One sort of glass half full perspective is that it looks as though the incidence of dementia, so that refers to the risk in any one individual, has been declining in most sort of rich Western countries. And these are data from the Framingham Heart Study cohort, which is a very large cohort study, which actually started way back in 1948. And these individuals had been followed, and their children actually, for decades with comprehensive medical evaluations. And what's being seen is that the 5-year incidence rate for dementia in the late 1970s was about 3.6. The units don't matter so much, but what's seen over the years is that there has been a consistent decrease from this 3.6 number in the late 1970s to about 2 in the late 2000s. And there's similar data in other sort of cohorts in developed countries. And so why is this the case? This is probably due to better control of vascular risk factors like hypertension, diabetes, high cholesterol, and higher levels of education. But certainly, this is actually not fully understood. So in terms of the lifestyle factors, how do they actually mediate risks of dementia? And in general, probably we could break this down into 3 very basic mechanisms. The first being effects on brain cognitive reserve, and things like education, potentially cognitive training, and intriguingly, possibly preservation of hearing may have impacts on the amount of cognitive reserve. Brain inflammation certainly is likely to be influenced by diet, by exercise, and damage to the brain, be that from a vascular cause, from neurotoxins, from oxidative stress. That is yet another mechanism by which these lifestyle sort of differences will mediate risk of dementia. So I'm just going to touch briefly now on some information that came out in 2019. And although there is certainly a significant proportion of the risk for dementia, which as of yet we do not understand how we can control, what this study showed was that the lifestyle interventions had a significant impact on genetic risk, even in those people with a high genetic risk. So this was a large population study of actually 200,000 individuals in the UK who were about 65 years old at onset of the study, and they had normal cognition. All of these individuals actually had a polygenic risk score done looking at the sort of risk variance for Alzheimer's disease, not the causative genes. So these would be the risk variants associated with sporadic disease. And they were classified into sort of high risk, medium risk, and low risk from a genetic perspective. And then basically what was done was 4 different lifestyle factors were looked at. So smoking, healthy diet, aerobic physical activity, and alcohol. So either low alcohol intake or no alcohol intake. And what was shown was that there was a 30% reduction in the risk of developing dementia over an 8-year follow-up period in those who had 3 or 4 favorable factors versus those with none or 1. And what was quite encouraging to me was that the effect of that reduction, that relative reduction of 30%, was as large in those with the highest genetic risk profile as those with the genetic risk, with the lowest risk. So I'm going to move on and just speak briefly about the Mediterranean diet. This does not have a consistent definition in the literature, and that probably reflects the fact that there's 16 different countries that border the Mediterranean. But in general, it's a diet that emphasizes vegetables, fruits, whole grains, beans, and legumes, includes low-fat dairy, fish, poultry, non-tropical vegetable oils and nuts, and limits essentially processed foods and fatty or processed meats. And for over a decade, there's been evidence from observational studies that there seems to be a reduced risk of developing dementia in those who follow a Mediterranean diet. And in 2018, there was some research looking at biomarkers of Alzheimer's disease and showing that they actually differed in those following a Mediterranean diet, giving some sort of clues about biologically what's happening. So this is a fairly small slide, I think, from on the screen there, but essentially on the top is a biomarker of Alzheimer's disease looking at glucose metabolism in Alzheimer's disease specific regions, with the top line being individuals following a Mediterranean diet and the bottom line individuals not following a Mediterranean diet. And the bottom graph is very similar, looking at another biomarker of Alzheimer's disease pathology, which is an amyloid PET scan. And essentially what was seen was that there was a slight difference in these biomarkers of Alzheimer's disease at the baseline, and the individuals were age 50 at the first evaluation. And with time, the amyloid markers, so markers of developing Alzheimer's pathology, increased in those not following Mediterranean diet more quickly than those who were following a Mediterranean diet. And based on the rate of increase and the difference at the first evaluation when people were about 50, it speculated that those differences in the biomarkers were probably present for 5 or more years, so even into the mid-40s. I'm going to speak briefly about hearing. So there has been a consistent association between hearing loss and development of dementia, and it is still a matter of debate whether this is causative, whether there is a shared underlying mechanism, whether there's something called reverse causation potentially. But in 2018, quite a large community study from France following 4,000 individuals found that there was a very significant increase in the development of dementia when these individuals were followed for a follow-up period of up to 25 years. And interestingly, the increased risk was not observed in those who were treated with hearing aids. So this is still not sort of definitive proof of causation, but I think this is quite interesting. And as I alluded to earlier, there may be a loss of cognitive reserve associated with lack of auditory stimulation. I'm running short on time here, so I'm going to very briefly speak about exercise. We've known for a couple of decades at least that physical activity is inversely correlated with dementia risk, meaning more physical activity, lower dementia risk when looking at populations over time. The biggest impact seems to be with midlife exercise, and there's some promising data and ongoing research on the effects of exercise in MCI and dementia. So just going to step back to what I discussed at the beginning, sort of a kind of idealized framework for how you would try to identify what lifestyle factors are associated with dementia risk. And it's now a few years ago, but this finger study did come relatively close to meeting this type of design. So the individuals were actually older adults, but they were randomized into different interventions. That one group receiving regular health advice, and the other group receiving specific diet advice on a frequent basis, intensive exercise, cognitive training program, and vascular risk factor monitoring. And what was seen was that there was actually a significant benefit on the cognitive testing after 2 years of the program. And this essentially is a very important proof of concept that this type of study can be done. The initial phase of the study was not designed to detect a difference in dementia, but there will be 7-year follow-up data to come. And there's similar lifestyle intervention studies in progress or to come in many countries around the world to see, if this can be generalized to other cultural and ethnic populations. So with that, I'm just going to give a couple of sort of broad summary points. Certainly what's good for the heart is good for the brain. Genetic risk in the sporadic dementias is not destiny, in that lifestyle interventions do still modify risk significantly, even if those at a high baseline genetic risk. I think there's some intriguing evidence that treating hearing loss may reduce the risk of dementia. And certainly ongoing and future research will allow us to better understand the effects of different lifestyle interventions. So with that, I'd like to thank everyone for their attention and pass things back to Dr. Foti, I believe.